Hi, Jonathan Hobbs here, developer of the Hobbs Masters Needling Series and chairman of the AACP in the UK. Just want to spend a couple of minutes just talking to you about the concept of n equals 1. So what do I mean by that? Well, n equals 1 is a typical scenario in clinic. If we take a research paper, let's say, with 400 subjects in, that'd be n equals 400, and that will have a certain inclusion and exclusion criteria, and we can draw from that when informing our practice, our clinical practice and our applications. So we look at that, and that inclusion exclusion criteria will be there to control those extraneous variables to some degree and to give the researchers a better idea of how accurate they can be with their decision making as to what the outcome is. Yeah. Now, the problem that we have with that is that when we get into clinic on a Monday morning, do our patients meet that inclusion exclusion criteria? So we've read that article, we like what it says. How do we apply that in the clinical setting? And what we find is all of a sudden our patients don't meet that inclusion exclusion criteria. So what we end up with is the concept of n equals 1, the individual. So how we treat the individual, well, that comes from a number of factors. We've got to think about the best external evidence. We've got to put that through the filter of clinician experience, and we've got to think about patient preference, and we've got to put that into context, which is the complete model of evidence-based practice. So always thinking about that n equals 1. And if you treat 20 patients in a day, that's not n equals 20. That's n equals 1 20 times. Your clinical day is a whole process of single case studies. And how do we evaluate, how do we treat those? So when we're thinking about applying acupuncture and dry needling, we're thinking about pathophysiology versus mechanisms, and we're thinking about the n equals 1 model and how does that fit together. And that just fits in with our whole concept of clinical reasoning. So I'll ask you just to consider whenever you're treating, yes, consider all those published articles, but also give some credit to your own experience and patient preference as well, put together with the structure of context within that as well and the environment you're in, and let that inform your decision making. So n equals 1 is important. It's what physio is all about. So good luck with your clinical reasoning, and hopefully I'll catch up with you again soon. You take care.